Hello, this is Dr. Gay from First Look MRI, and this is a 57-year-old male who complains of right hip pain for about 2 years. The pain is most pronounced anteriorly and it's getting more severe, so the patient went to the orthopedic surgeon and they ordered an MRI of the right hip, and we see that the patient does have some asymmetry. This is the right hip, left hip. We see that the left femoral head, which is this round ball, is nice and round, very uniform. It looks like a tennis ball, just perfectly spherical. This is the cup it rotates in, the acetabulum. So this is a normal left hip. And on the right hand side, we see that the femoral head is not round. It's flat on the upper outer side, broad. And we see that if this right femoral head rotates, this broad area is going to pinch into the acetabulum here. Up here on the left side, if this rotates, it's just going to rotate nice and uniform in that cup. But on this side, this broad area, like a cam, is going to go up here and pinch this tissue. And this patient does have an abnormal signal right over here. This is in the region of the hip labrum. We see that there's intermediate signal and fullness. Here's the left hip labrum over here. Right hip labrum is torn, and there's inflammation over there and maybe scarring. And so we call this femoroacetabular impingement, when the femur pinches the acetabulum and results in injury to the labrum. You can also get marrow changes. The patient did have some marrow changes, but this was only part of the problem. The main pain was coming from something else, which was in the front of the hip. And their pain was in front, and it was related to this long, tubular-looking fluid collection. And this is an enlarged, inflamed Iliopsoas bursa. We call this Iliopsoas bursitis. And to get the anatomy down for that bursa, we see a dark band coming down here. This is the psoas muscle. Here's the left psoas muscle, right psoas muscle coming off the spine. This is the ilium. This is the iliacus muscle. So the psoas and the iliacus muscles come together, and where they come together, there's a potential space that can become inflamed called the Iliopsoas bursa. And this patient has a really prominent case of Iliopsoas bursitis. On this case, this image here, we see this area that has markers on it. This is that inflamed bursa, nice round tubular fluid collection. And this is the femoral head. We have arthritis in the femoral head, a little bit of marrow edema, and a big inflamed bursa. This is another view where this really stands out. Now fluid is bright. You can see fluid in the bladder bright. We see this inflamed bursa, some marrow edema of the femoral head. And this is another view where fluid is bright. We can see this tubular, inflamed, enlarged bursa, some little nodular synovial inflammation within this. So, case of rip roaring Iliopsoas bursitis. And this can be associated with rheumatoid arthritis or osteoarthritis. In this case, the patient has osteoarthritis. Also, athletes who flex their hips can get rubbing of these muscles together, and this can become inflamed. But in this case, it may be related to this hip arthritis and ischiofemoral impingement, but a case of Iliopsoas bursitis.